Leukemia was so named because leuk means white, and emia, blood, so your blood turns white, so you have this proliferation of white blood cells. Leukemia is a neoplastic proliferation or a malignancy of white blood cells. And white blood cells are programmed normally to go around your body and go everywhere and check things out. And so when they become malignant, they still have that capacity to go anywhere. Data is a couple of years old, but in terms of incidence in this country, it's number 11 in terms of death. It's number 6 of tenure. So the fact that the deaths is much higher than the incidence rate tells you that the therapies available for treating it are leave something to be desired. There's a nearly infinite number of different ways to administer anti-cancer therapies. There's different drugs and different combinations and different doses at different times. There's drugs, there's radiation, there's surgery depending on what it is. So there's all these different ways you can do things, and there are new agents coming out. The treatment of pediatric leukemia is one of the great success stories of oncology. I mean, decades ago it was highly lethal. Now approximately 95% can be pushed into what's called complete remission. So with treatment, the disease appears to completely go away. And in a small percentage of those cases it will come back and there will be a poor outcome, as they say. But the lifetime cure rate's approximately 90%. They're definitely a positive. I mean, they raise awareness about these diseases. And, they foment the shared sense of community and support. But in terms of the actual dollars raised, you can make a very good argument that giving money specifically to one disease or another disease is kind of foolhardy. Young people do get leukemia. Higher rates than most other cancers, and so it can strike any age group, which is depressing in one way. But the fact that we do have effective therapies for some of them also means that when you make the diagnosis of someone who's younger, oftentimes that indicates that something can be done about it. So I think it is important. I think for younger people to realize that it can affect them. You can get leukemia when you're a teenager, in your 20s and 30s. So.